Hello students, welcome all. In this video, we'll learn about the essential newborn care. So the first 28 days of life is known as the neonatal period. Okay, is the most vulnerable time for a newborn. A large proportion of neonatal deaths occur within this first 24 hours after birth, mainly due to preventable causes, okay, such as asphyxia, hypothermia, infection, and feeding problems. An essential newborn care refers to a set of simple evidence-based practices provided to every newborn immediately after birth, during the early neonatal period, regardless of the place of birth. These practices ensure survival, growth, and healthy development of the newborn. Okay. Myself, Ruth Kezia, working as a lecturer in MMM College of Nursing. Objectives we'll see about the introduction, immediate care at at birth, and establishment of open airway and circulation, initiation of breastfeeding, thermal care of the newborn, umbilical cord care, skin care and eye care, infection prevention, administration of medication, identification of newborn, ongoing assessment and monitoring, care of preterm babies, parental counseling, documentation and continuity of care, and conclusion. These all things we'll see in this video. Introduction. Essential newborn care refers to a set of evidence-based systematic nursing intervention provided to a newborn immediately after birth and during the early neonatal period to ensure survival and prevent complications and promote optimal growth and development. Nurses and midwives play a vital role in delivering essential newborn care by providing immediate, continuous, and family-centered care to help the newborn adapt to this extrauterine life. So to explain this essential newborn care, I'll just give an example. So think of this newborn like a delicate sapling. You know, sapling means a budding plant, small plant. If this sapling is protected from the cold, it grows well, right? That is called giving thermal care. If this sapling is watered regularly, it survives, right? So that is equal to breastfeeding the newborn. And if this sapling is prevented from being affected from the pest, okay, that means giving infection prevention for this newborn. And also if you give nourishment to the soil of this sapling, then the sapling will grow well, right? So same way you have to give immunization and nutrition to the newborn. So similarly, a newborn needs warmth, nutrition, protection, and observation to survive and thrive, okay, to grow. So that is called these are the set of practices, okay, evidence-based practices. So they are called the essential newborn care. Objectives. What are the objectives of essential newborn care? To ensure breathing and circulation, to maintain normal temperature, prevent infection, identify and manage problems at the early, and promote early breastfeeding, prevent complications, reduce mortality and morbidity rate of the mother as well as the newborn, and also educate the parents on newborn care. Immediate care at birth. Immediate care at birth is the first and most critical component of essential newborn care. The nurse will receive the newborn in a warm and clean environment. She will ensure airway patency by proper positioning, clear the secretions only if necessary, and also assess the breathing and heart rate and stimulate the breathing if required. Apgar scoring is performed at 1 and 5 minutes to assess the newborn's adaptation to extrauterine life. Gently handle and prevention gentle handling and prevention of unnecessary suctioning are emphasized at the immediate care at birth. Okay. Establishment of open airway and circulation. First is positioning of the open airway. Place the newborn in a neutral or slightly extended sniffing position. Ensure the tongue does not obstruct the airway. Clear the secretion. For clearing the secretion, you can use a bulb syringe or a suction catheter to remove the mucus or amniotic fluid or meconium from the mouth and nose and prevent any airway obstruction and also facilitate effective breathing. So this suctioning will prevent airway obstruction and it will facilitate effective breathing. So if there is any any secretions, you can use this the suctioning technique. Timing of suction only if the airway is blocked or there are any visible secretion. If you can see by your eyes from the mouth if there is any secretion, you can use the suction. Routine suctioning of vigorous newborn is not recommended because it can cause trauma. And monitoring during suctioning, observe the signs, observe the changes of the color, breathing effort and heart rate while suctioning. Prevent hypoxia and vagal stimulation which may cause bradycardia. So next is, so this is about the immediate care at birth, how to establish the pet airway patency and also promote breathing. Okay, and how to establish airway and promote breathing, how to do suctioning if required. Okay, so next is initiation and maintenance of breastfeed. So what you have to do is proper positioning and attachments. Make sure the mother uses a correct technique of breastfeeding. Okay, technique means how to hold the baby in hand, how to see the nipple of the mother goes well into the mouth of the baby, and where the eye movement, the eye contact of the mother and the baby. Okay, all these are some of the techniques you have to watch for proper positioning and attachment of the areola. And promote feeding on demand. Okay, as and when the baby cries, you have to advise a mother to do breastfeeding. Encourage colostrum feeding. So colostrum is a initial milk that comes immediately after the delivery, even during the antenatal period. So that should be, that contains a high amount of antibodies, IgG and IgM antibodies. So that is encouraged to give to the baby. Okay, because it gives much disease protection and prevention. And prevent pre-lacteal feeds, so no formula feeding, and support exclusive breastfeeding. It means giving only the breast milk, not any other water or sugar, nothing. And teach about areolar attachment. As I said in the breastfeeding technique, the areolar attachment should be taught well to the mother. This is how you should initiate and maintaining the breastfeed. So next is about giving thermal care for the newborn. The first main thing is we want to keep the baby warm, because in the intrauterine life the baby had a very warm environment. As soon as the baby comes out, the baby will feel very cold. So how you can promote thermal care? By giving skin to skin contact. Place the baby on mother's chest, that is kangaroo mother care, and warm environment. Keep the delivery room warm at least 25 degrees centigrade and free of drafts. And why thermal care is important? So because it can prevent hypothermia and reduces the risk of infection. You have to provide warm clothing, wrap the baby with warm and dry clothes and cover head. And immediate drying. Okay, dry the baby immediately after birth and remove any wet linen. Okay, the temperature should be 36.5 centigrade to 37.5 centigrade, or in Fahrenheit 97.7 to 99.5 Fahrenheit. Okay, this is the temperature should be maintained for the newborn to establish, to promote the thermal care in the newborn. Next is umbilical cord care. Okay, criteria. We want to give cleaning and drying. Okay, clean the stump with the sterile gauze or 70% alcohol. Keep dry and fold the diaper below the stump, because it will prevent infection and promote natural drying. Handling. Avoid pulling and manipulating the cord, because it will prevent bleeding and injury. Observation. Check for redness and swelling and foul odor or pus, because it can promote early detection of infection. And bathing. Give sponge baths until stump falls off to reduce infection. Parental education. Teach proper cleaning, diapering and warning signs to ensure safe home care. Next is about the skin care and the eye care. Proper skin care helps maintain the integrity of newborn's delicate skin. Nurses clean the newborn gently, avoid excessive bathing, prevent diaper rash, and maintain natural skin oils. The eye care includes cleaning the eye with sterile swabs from inner to outer canthus and administering prophylactic antibiotic eye ointment to prevent ophthalmia neonatum. So as you see in the picture, you can promote the skin care and the eye care. Next is regarding this infection prevention in essential newborn care. How you can promote the infection prevention, how you can carry out by performing the hand hygiene, maintaining a clean environment, monitoring the body temperature, okay, and observe for the danger signs, early identification and referral. Okay, so this is how you can do this cleaning, this is how you can do the infection prevention in newborn care. How you can do this hand hygiene, strict hand hygiene and aseptic technique, maintaining the clean environment, clean the delivery area and disinfect the equipment, monitoring the body temperature, keep the baby between the 36.5 to 37.5 degrees centigrade, and report any increase or decrease in the temperature, and early detection and referral, recognize any danger signs and refer promptly. Okay, so the nurses must follow a strict hand hygiene, maintain a clean environment and body temperature, and observe signs, any signs of danger, like poor feeding, lethargy, fever, hypothermia, fast and difficulty in breathing, jaundice, seizure. All this must be identified and should be reported promptly. Administration of medication and immunization. Nurses administer essential newborn medication, okay, such as intramuscular vitamin K to prevent hemorrhagic disease in the newborn, and birth dose immunization including BCG, oral polio vaccine and hepatitis B vaccine are given according to the national immunization schedule to protect the newborn from preventable diseases. Identification. So newborn identification is very much important. It should include the name of the baby, okay, and weight of the baby, the mother's name, okay, and also the unique UHID number, also the sex, okay, name, date and time of delivery, sex, weight and mother's name and UHID number. All this details must be there in the identification of the newborn. Assessment and monitoring of the newborn. Ongoing assessment and monitoring are the integral part of essential newborn care. So what all you have to monitor? Weight, okay, birth weight, length, head circumference, vital signs, urine and stool output, blood glucose if necessary, and you have to detect any congenital anomalies, birth injuries and feeding problems. So coming to the care of preterm and the low birth weight newborn. Preterm and low birth weight newborn requires special nursing care. So nurse should provide kangaroo mother care. So KMC comes first for this preterm newborn. Okay, enhance the thermal protection, feeding support, infection prevention, close monitoring of the vital signs and growth to improve survival and developmental outcomes. Parental education and counseling. So the nurse counsels parents regarding breastfeeding, thermal care, hygiene, cord care, immunization, recognition of danger signs, follow-up visits, home-based newborn care practices. So this empowers families to provide safe and effective care at home. Documentation and continuity of care. Accurate documentation of the newborn assessments, interventions, immunization, and parental education ensures continuity and quality of care. So the nurses communicate effectively with the healthcare team members to facilitate timely follow-up and referral. Conclusion. So this essential newborn care is a comprehensive nurse-led approach that addresses the immediate and ongoing needs of the newborn. Through timely interventions, vigilant monitoring, and parental education, nurses play a vital role in reducing neonatal morbidity and mortality and promoting a healthy start of this life. So, thank you all. I hope you gained some knowledge regarding this essential newborn care. We'll see you in the next video. Thank you.